Hi, good evening and welcome to the ZP Developer Zone webinar. So we like to do this webinar once a week and it's really just answering technical questions that have come in during the week. So it's not quite the 22nd of September 2024, but things are always a little bit quieter on a Saturday evening. So we've gone live a little bit earlier. First of all, I think about 8 questions tonight. The first one's actually an explanation of cyclic voltammetry. So somebody sent me some cyclic voltammetry data. In it, they've been testing sometimes in the presence of aromatic compounds, sometimes in the presence of hexane, so I'll go through that cyclic voltammetry. Somebody else was asking about drop casting onto a screen printed carbon electrode, so that's quite straightforward and I will address that. Somebody else was asking about screen printed electrodes with 2 working electrodes, and I will address that. Question number 4 is a little bit similar to question number 1. This is actually just testing in the presence of polyluminol. In the presence of polyluminol, though polyluminol is described as conductive, it doesn't mean that it has a surface that's necessarily able to exchange electrons with ferrocyanide, and I think that's really the case here. Somebody else is interested in doing screen printed electrodes with wearable electronics. So question number 5 and question number 6 are really similarly related. Question number 6 is somebody who's been using our technology for a while and has actually got quite far with it. Question number 5 should actually watch what question number 6 is doing. Question number 7 is probably similarly actually just watch question number 5 and question number 6, because question number 7 you may want to expand out to lactate and hydroperoxide, which you can do, but I think maybe I would actually watch question number 6 if I was question number 7. Question number 8, somebody's interested in things like hydration and fat and uric acid, etc. So I will address question number 8 as well. With that said, we do have some upcoming webinars. By the way, if you see technology in front of me, it's because I'm only going to touch very lightly on this wearable biosensor. The reason I'm going to touch very lightly on it is some of these questions people are wanting to, for example, measure glucose. This technology is not something we will ever put through the website, etc. This technology had 20 million euros invested in it so far. But this is a wearable microneedle technology. It's got 50 patents on it. At the moment, it's most tuned for continuous glucose monitoring. This is the set of electronics. Well, not sort of electronics. This is the microneedle patch, and that gets pulled into my wrist. It's probably pertinent to number 8, where question number 8 is kind of interested in those kind of wearables and things like uric acid and stuff. Simply said, that watch does not work. There's no way that watch works. Now, when I say that no way, I'll use the FDA, the Federal Drug and is it the Federal Drug and Food and Drug Administration? Yeah, I'll talk about the FDA in a bit. Not super pertinent to tonight, but at ZP we do a very 2024 potentiostat. So, for example, in fact, this will be applicable to people who are doing things like glucose, so there's a bit of amperometry there. If somebody's interested in doing something like a potassium, there's, just get this open circuit potentiometry. So this, and in fact I'll just connect to the device now. So with ZP we do have a very up-to-date modern potentiostat that's very good at actually going beyond just doing lab experiments and actually then going on to do real-world applications like pH and glucose and potassium and testosterone, etc. Let me slightly change focus now and go back to really the main thing. Just to say, if you're interested in making devices for point of need testing, point of care diagnostics, then please come to our webinar on the 24th of September 2024. If you are interested in wearables, which many of these questions actually are, and we're doing a session on the 1st of October 2024. You notice with our webinars, and by the way, if you see a link pop up, I'll make sure I put the link underneath the video as well. You'll notice with our webinars that we do one in the morning, one in the afternoon, because we appreciate we live on a globe with very different time zones. But the nice thing about I live near London is that we're sort of in the middle of all these time zones, so we're not a bad place. When we do the mornings, we cover Asia, and when we do the afternoons, we cover the USA, for example. With that said, let me go forward. So we do webinars. If you're an academic and you are interested in really translating your science out of the lab and into a more sort of impactful state, then please come to our webinar on the 25th of September. I realize a couple of these webinars are just next week, in fact. The wearables one is probably about a week later on the 1st of October. It's probably worth saying as well, we have not done a workshop for a very, very long time. In fact, well, it's a very, very long time actually. That's about a year. But we are going to hold a workshop. Now our workshops, there's going to be at least 6 practicals involved with this. Our workshops are not just people talking. They're very hands-on, they're very interactive, and we're going to do a workshop, a live workshop on wearables and point of need testing. This will be taking place in Norway. So the ZP facility is about an hour and a half from Oslo. So if you want to get to it, you have to sort of fly to Oslo. There's a train that will then take you to where we are, which is Trondheim. And this will be on the 20th and the 21st of November, 2-day workshop, and I will be leading it. So just, you can get some free webinars next week, and then if you're particularly interested in wearables, there's one on the 1st of October. If you're interested in actually getting more of a hands-on experience, then it will have to be 21st of November in Norway. Again, if you see a link today, that link will be underneath the video afterwards. So question number 1 is about cyclic voltammetry. So the first thing to say is this person's not using screen printed electrodes. I am a big fan of screen printed electrodes because, you know, as I always say, we're very biased because in fact we do produce screen printed electrodes. But I'm a big fan of screen printed electrodes because if science is really going to leave the lab, it's not going to leave the lab on a gold disc electrode, and it's not going to leave the lab on a glassy carbon electrode. It's actually going to leave the lab in a form factor, lo and behold, just like this. And those webinars, there's one for academia, for example. Come to that webinar to kind of see this in a bit more action. But let's get back to the main thrust here. So I've the nice thing about ZP and these let's say these weekly webinars is we will cover technical questions that come in. First thing to say is this is done on a gold electrode, and they kind of describe it as a simple gold electrode and a modified gold electrode. This discontinuity in the data, it's no big problem. You don't, sometimes when you read academic papers, you don't see this discontinuity because they actually show you the second scan, or they may start the voltammetry at open circuit potential. You get this kind of discontinuity because here the operator said, okay, start the voltammetry at 0 volts, scan up, and in fact, you know, so they scan up and they scan down, but that discontinuity is because you've essentially started the experiment at a 0 volts, and really there is actually some electrochemical activity at that 0 volts. So in fact, you get a little bit of electrochemical activity. If you started it at, if you told the potentiostat to start at open circuit potential, then you probably wouldn't have had that step. I'll show you that we also get that step in our data as well. And the reason you don't see it in papers too often is because actually they don't show you the first scan, they actually show you the second scan. Because by the time you get to the second scan, you will have lost that kind of discontinuity in the data. So it's because you started the experiment in a place where there was a little bit of electrochemical activity. But if you just reported on the second scan, you wouldn't have seen it. It's not talked about too much, actually. It's not in textbooks, etc., because it's kind of one of those experimental details that people know about, and I think, you know, it's not even taught, let's say, but once you start doing cyclic voltammetry, you become aware of this. It's not an issue, it's just a feature of the way where you started the experiment. This signal that you're looking at here on this particular electrode, this is the unmodified electrode, is the reduction of oxygen. This is going to become important in a bit because all of your signals are actually the reduction of oxygen is what you're looking at. So you've got this gold electrode, you've got oxygen. I didn't say, and you're reducing it to get this kind of blue voltammetry. I didn't say what species you were forming because the species that you're forming sort of depends on the pH a little bit. So I didn't commit to that, and it doesn't really matter. But to this discussion, it just means what you're seeing there is reduction of oxygen. If you're not sure about that, get some sodium sulfite, which is known as an oxygen scavenger. it will react with oxygen. So you've put some crystals into your solution, it'll react with oxygen. This signal will decrease depending on how much sodium sulfite you put in there. And that will tell you that you truly are looking at the signal for oxygens, because you're forming sodium sulfate and you're essentially scavenging or mopping up the oxygen. When you actually modify the electrode, the blue voltammetry goes away, because in fact now I think you're actually blocking the oxygen from actually getting to that electrode, or if for some reason the oxygen concentration is actually lower in that electrode. It's become significant because it really helps me understand the rest of your voltammetry in a bit. So in this particular case, this is looking at a simple gold electrode. So I'm using their terminology here. When they're testing the simple gold electrode, at 5 minutes they get the blue voltammetry. At 50 minutes they get the red. I think at 20 minutes they get the green. And then at 25 I think they get the purple, but I didn't show the purple here. The signal is decreasing with time. Now, why is the signal decreasing with time? The reason the signal is decreasing with time is because this aromatic compound, I'm not entirely sure what the aromatic compound is absorbing onto the surface. So it's essentially blocking the electrodes to that oxygen reduction, because you have an opposite effect in a minute. Or no, actually you don't have an opposite effect. You don't have this effect. So how do I understand this voltammetry? I understand this voltammetry because, first of all, on a fresh electrode, you get the oxygen reduction. With time, the oxygen reduction decreases. Why does the oxygen reduction decrease? Because I think the aromatic compound is actually sticking to your surface and starting to block your surface, at least starting to block it to oxygen reduction. When you do a similar thing in hexane, you do not get that. So it tells me that hexane is not depositing onto and blocking your electrode. I was thinking a little bit, it might be electropolymerization that's actually happening with the aromatic compound, but I don't really see much evidence of electropolymerization, so I'm not going to say that it is electropolymerization that is going on here. But you can see a difference between the hexane and the aromatic compound. So the hexane sort of doesn't just stays consistent whether you've been soaking for 5 minutes, 15 minutes, 20 minutes, 25 minutes, it all stays the same. So hexane is not in the same way absorbing and blocking your surface. So that's your simple gold electrode. Now let's go to your modified gold electrode. So with your modified gold electrode, you have your oxygen reduction, and that actually decreases with time. I've got a suspicion that, in fact, what's happening is you are probably dissolving your material. I've got a super suspicion. But in fact, the aromatic compound is sticking to the surface. So with the aromatic compound, you lose signal of oxygen with time because the aromatic compound is actually sticking to the surface, like I was showing earlier on. Because this is the modified electrode, your hexane signal is increasing, and I think with hexane, I think it's increasing, and I think what's happening is you're actually dissolving away your modified material, and essentially you're exposing more and more of your gold electrode, and you're increasing your oxygen reduction because of that. So a lot of your signal is due to actually oxygen reduction, and hexane dissolves away your surface and the oxygen reduction increases in the presence of aromatic compounds. The aromatic compounds may also be dissolving that polymer, but I think they're actually absorbing onto the surface, so you kind of get the opposite phenomena. So just FYI, I think that's really what's happening in your voltammetry. By the way, I just said that we also get that discontinuity sometimes in our cyclic voltammetry, and I can see it. I just grabbed some data that we were gathering in our lab, and I could just see the discontinuity here as well, because we kind of started the experiment. Suppose you started the experiment sort of in the middle of your voltammetry. If you'd started it to one of the edges, you may not have had such a quite an obvious discontinuity, but it's just where you started the experiment. If you started it, as I say, at what's called open circuit potential, then you may not have seen it quite so much. But often when people are reporting data, they're actually showing you the second voltammogram, so they're kind of hiding, let's say, that. And it's not a problem. It's no criticism of anyone's work. It's just you can see where you essentially started the voltammetry. Question number 2, somebody wants to drop cast onto a screen printed electrode, and because of that, we actually came up with this new, we came up with this new design of an electrode. I should really make sure I put a link underneath the video so you can actually find this. simple enough to, with this electrode, to be able to just drop cast onto there, and with a few microliters of solution, and that's super simple because that is the working electrode. I don't have one of those electrodes with me tonight. I have one of those rectangular electrodes, but I do hope that if people are getting into using screen printed electrodes, or translating some of their science, trying to get it sometimes out of the lab and onto platforms that are more representative. I just do the cyclic voltammetry, in fact, amperometry. There's cyclic voltammetry there. If you are trying to get onto a much more modern potentiostat that's has the ability of actually taking the science out of the lab and into the real world, please check out that Sense It All potentiostat. With that said, let me just scan back to this, so it's easy enough to drop cast onto these circular electrodes. It's probably worth saying as well that we've really worked hard on the design of this screen printed electrode. It's some of the modern potentiostats that you can find on the market actually have a problem with compliance voltage. Everything's become very low power and USB-C driven. And the problem that they're not telling you is, in fact, that they have a problem with compliance voltage. But this particular screen printed electrode is really good, A, for being able to functionalize on that working electrode, but also it's got a very good counter electrode, which really helps with the compliance voltage. Question number 3. Somebody wants 2 working electrodes. It's perfectly fine. But we would actually use what's called laser ablation. We have gold, and we can ablate a sheet of gold to give you essentially any design you actually wanted. But we would do it as a micro project, because I think there's always a lot of design and discussion in these projects. You know, when somebody wants something bespoke, you have to give people a lot of advice, and so we actually treat it like a micro project. So if you're interested and you've got the budget for about €6,500, then we're happy to give people what they want. But we would treat it like a micro project. We won't just quote. We will sort of want you to pay. We want to get you online, discuss it, and then we'll come up with a design for you. Question number 4. This is an interesting one. Another one about cyclic voltammetry. What I found really interesting about this was actually that there's a bare glassy carbon electrode here, which actually has slightly higher peaks than the graphene carbon electrode, and they put polyluminol over the electrode, and I'll discuss that in a minute. But what's really interesting is that the graphite electrode actually has the peak-to-peak separation is a little bit closer with the graphite relative to the graphene. With the graphene, they move out, the peak-to-peaks move away from one another, and with the graphite, the peaks are slightly higher, and with the graphene, they're slightly smaller. Graphene, people think that it's some sort of real wonder material and it's going to really help with biosensor sensitivity. This data alone is not my data, this is that author's data, but it shows you that graphene is not the wonder material that people say it is, because actually your voltammetry is better with graphite than it is with graphene. So I think the graphene bubble will sort of, pass. Once upon a time it was multi-wall carbon nanotubes, then it became single-wall carbon nanotubes as the wonder material. Now at the moment it's graphene, but these things will come and go. When you put the polyluminol on, you actually lose signal altogether. Now the source of the signal here is a mixture of probably ferroferic. So ferroferic is exchanging electrons really well with the graphite. It's exchanging electrons okay with the graphene, but once you put that polyluminol over the top of that graphene, it all shuts down. Well, what's going on here? Well, you're very kind as well, because you've actually given me the EIS data as well, and the electrochemical impedance spectroscopy data. Now they're showing their data here in what's called the Nyquist plot, and I can see really carefully that with the graphite, the reason you get the best cyclic voltammetry is because you've got the smallest charge transfer resistance. And I think the author of this data knows this kind of stuff. This is something they're known to them. That's why they've shown it to me. But it shows me here that you've only got like 100 ohm type of resistance, your charge transfer resistance. With your graphene, and I really think that you've done a great job here of actually demonstrating that graphene is not a wonder material. Actually, the charge transfer resistance has gone up to something more like 600 ohms, because you can see it in the Nyquist plot. The semicircle has a diameter of approximately 600 ohms, and you can see that also in the voltammetry. So the EIS and the voltammetry telling me the same story. And then you put this luminol on there. I realize if I look really carefully at your luminol, I think I can actually see a little bit of some peaks here. You've probably got a very distorted if I was to zoom in on that, there's actually a very distorted voltammetry for ferrocyanide. But it's all very distorted because, in fact, the charge transfer resistance has got huge. And you've shown me half the semicircle here. So if I was to imagine that semicircle going all the way around, that tells me you've got like a charge transfer resistance of like 120,000 ohms. Just make sure 120,000 ohms, 120 kilo ohms, 120,000 ohms. It's massive compared to everything else. So actually, now what that means is, it doesn't mean that, polyluminol is not conductive. What it means is it's not very good at exchanging electrons with ferrocyanide. I think I had a look for the literature, and I'm not sure that I did find any. If this polymer was a bit more porous, so that the ferrocyanide could get through the polymer straight to the electrode, you probably have a bit more of a signal. But I suspect you've got a very good coating of this polyluminol, and it's telling you if it's conductive, that's fine. But it doesn't, just because you're conductive doesn't mean you can then exchange electrons with the ferrocyanide, and that would actually suggest that you're not exchanging electrons with it, because you lost all your voltammetric signal, and your charge transfer resistance between polyluminol and the ferrocyanide was 120,000 ohms. So your own data is telling you, is backing up what I'm sort of saying essentially. So in the presence of graphite or graphene, you are getting a good exchange of electrons, and you get a decent enough cyclic voltammogram, but it all shuts down when you do the polyluminol, because the polyluminol is probably coating the surface as you intended. It's a very organic compound, which probably means that it doesn't necessarily want to do a one electron exchange with ferrocyanide. It probably preferred to do maybe 2 electron exchanges. So in fact, it's not. I should say it's not super surprising, but it's not super surprising because I'm talking about hindsight. Hindsight's a great thing, but I can be very clear here that you. It's no criticism of you, but you do not see it, because in fact your own data tells you that the charge transfer resistance between ferrocyanide and polyluminol is very high. And don't confuse the fact that something is conductive as meaning that it will then just naturally exchange electrons with ferrocyanide. I could give you probably another example, in fact. So it's easy to oxidize hydrogen peroxide on platinum, but it takes a bit more potential to oxidize hydrogen peroxide on carbon. So different materials prefer different surfaces, and you're saying, and your data says that ferrocyanide doesn't really like exchanging electrons with the polyluminol surface. So I hope that helps you explain your data a little bit more. A lot of these questions now, I realize they weren't intended to all be mixed up, but I realize that they are actually mixed up a little bit. If you're interested in measuring glucose with SPEs and wearable electronics, then we do have some wearable electronics. This is the electronics. This is the breakout board. This is, and I'm very grateful to them, data from question number 6. So wait for question number 6. But if you want to dip your toe into wearable glucose sensors, start off simple. Work on technology readiness level number 3. Technology readiness level number 3 means you've proven something to work in the lab. And the parts you'll need are the electronics, the glucose sensors, and the test solutions. And I'll try and remember to put all those links underneath this, underneath the video after we've gone live, which we're going live now. Question number 6, great question. These guys have been working on this for quite a long time. So they've got a single-purpose biosensor electronics from us. They got a glucose sensor. They're wondering why their data A doesn't look like this, and B, why they don't have quite as much signal as us, and why they don't get steady state like us. The reason that our data on some of our websites and data sheets looks like this, in fact, their data is actually better than ours. We probably got better at making this data is quite old, if I can put it that way. It's probably pre-2019 data. So today of making this video, it's 2024. So this data is probably over 4 years old. We got the data by putting that sensor into a beaker, filling it up with a solution, stirring away. It's a very, very different setup to the one you're using. So one thing with biosensors, I suppose that's a temperature sensor is a temperature sensor. It's less sensitive to the way you do the experiment. A biosensor is different. it's in very intimate contact with the analyte and the solution. The way the solution is, the way the analyte is, the way you bring the analyte to that sensor, they all influence the signal. So we are doing a very different experiment when we're actually doing that. This is not the way you did your experiment, and then we're stirring. Stirring, part of the signal intensity is what's called mass transfer. If we stir very slowly, we get one signal. If we stir very fast, we get a bigger signal, because it's the rate at which the material is arriving at the electrode. So you're doing, in fact, I've got a video here. This is Andre, and he was, in fact, doing exactly the way I described that experiment, where we would take one of our sensors, put it in a solution, start adding glucose while stirring, by the way. If you watch the Andre video, you'll see that he is definitely doing that, and the signal goes up with time. So you are doing your experiment in a very different way. So be very careful about looking at that data sheet and then looking at your signal saying, well, why am I only getting a fraction of the signal? They're very different experiments. It's interesting. Whose is the right way to do it? There is no right way to do it. You have to do the experiment in the way that's probably most representative of your final application. If you're trying to make wearable biosensors, I mean, wearable biosensors, solutions are flowing, but they're not flowing very fast. So probably the way you're doing it is in partly the correct way of doing it. So this is your setup. This is the way you're doing the drop. So you've got a static drop, and you're testing it against known glucose, and you get, you get this very nice staircase. You bring the signals up, you bring the signals down, and you notice that if you take the signals at different parts of what you have under here is a Cottrell response. I will explain the shape of that signal now. So we get a signal that's what we call steady state conditions. We're stirring. You're not stirring. You get a signal that actually is non-steady state conditions. It goes high and then it drops with time. You've got what's called a depletion zone building up. It's no criticism of you. It is not a criticism of you. It's just to tell you that there's glucose near the electrode and you're consuming it, and more has to diffuse in, and you consume that and more has to diffuse in. So you've got a small volume next to a fairly big electrode, and you're consuming the electrode and building up a depletion zone. And you get like a Cottrell response, so the signal falls with time, and then depending on where you take the time, it never quite reaches, let's say, steady state. It's not a criticism of you, it's just the way you're doing the experiment. So you didn't get the same current as us, but you did get signal versus concentration. You didn't get the same current as us because, in fact, we're doing experiments in very different ways. In fact, you got better linearity than us. We're showing you data on sensors that is quite a long time ago, so we've probably improved over the years as well. Is this a problem? You state it like a problem. It's not a problem. It's just a function of the way you're doing the experiment. It's not a problem. This is the way the sensors work. If you did it in a stirred reactor, you'd find you'd get a different type of signal. You're more or less proportional to glucose concentration. Good. That's the way it should be. So your data is actually better than our data. You should expect linearity between 0 and 20 millimole. That's the way we've designed the electrodes. Accuracy is a hard one. The accuracy there's lots of definitions of accuracy. The technology on our website will bring you to technology readiness level number 3. Technology readiness level number 3 means that you've done a proof of principle in the lab, and you've proven it. You've actually shown signal versus concentration. You've gone up, you've gone down, and it's, to me, it's all looking pretty healthy. I will talk about accuracy again in a minute. Your goal is 3 to 4 weeks with only a calibration every 12 hours. Your goal is probably to make a wearable biosensor. That is a tough goal, okay? This watch, which is a wearable glucose sensor, 50 patents behind it. I've spent 20 million euros on that. In fact, I'll grab this one. This is Abbott. I have a super strong suspicion that Abbott have spent something like $1 billion getting to. This is their second generation product. They're on their third generation product now. Dexcom spent $500 million US getting to market with their CGM. When Dexcom and Abbott first went to market, they were actually doing 4 blood tests on the patient per day in order to keep the CGM calibrated. So you can, and nowadays, by the way, they do 0 blood glucose tests. So the answer is you can achieve good accuracy with 0 blood glucose tests. This doesn't require blood glucose tests anymore. But it's taken them a lot of money and a lot of time. The technology on our website will raise you to being able to do your first lab demonstrations. But please don't then think, wow, some of your ambition here means that you have to get properly funded in order to really be able to afford to go, to some of what you're trying to do. It's realistic. It can be realized is the answer, but understand the investment that companies actually made in order to kind of achieve those kind of things. You never reach steady state because in fact what you're doing is you're building up what's called a depletion zone, and then you're probably actually starting to consume the glucose in that drop because it's a fairly small volume. But if you did it in a stirred reactor, you would probably then reach steady state. Just on accuracy, by the way, it's probably worth saying that Dexcom, they claim to have the best clinical accuracy, and they get about an 8% mean average relative difference. Mean average relative difference means that if they've got Dexcom don't have a watch like this, Dexcom actually have a patch, but mean average relative difference says what this watch says and what a glucose strip says, and then you say what's the difference, and on average they're about 8% difference between the glucose strip and the in their case their wearable patch. Question number 7. Can we customize sensors to measure analytes such as, we do have a glucose sensor, we do have a lactate sensor, we also have a hydrogen peroxide sensor as well. These people are also very interested in cortisol as well. Cortisol is something we have on the website, but we don't sell it on the website because it's too much of a valuable sensor. The kind of programs that we use cortisol sensors on are being funded for like 2 million euros, so we just do not put it on the website. But all of these sensors, we have them all, we have background in them. I would always say that if somebody was first trying to dip their toe into wearable biosensors, I would suggest glucose is probably the best one. Potassium is a really good one with us. Sodium's a good one with us. So glucose is a good one because it teaches you a lot. It's a very robust sensor. Potassium, I think, is a good one for people with dialysis, who need dialysis. It's also quite a good one, I think, for measuring dehydration. And I think sodium's also got a bit of a reputation for being able to quite good at measuring dehydration as well. Question number 8. It's quite interesting actually. With question number 8, they've got a watch, I think, or they've got some sort of technology that says that it measures blood sugar and fats and uric acids. It's not true. There were a spate of watches that were going around saying that, non-invasively they were measuring glucose. None of those watches are true. And if it's not true for glucose, it's not true for uric acid, and it's not true for blood fats either. And you do doubt it yourself whether you actually believe the accuracy. You cannot believe the accuracy of those watches. The FDA ended up having to put a warning out on this because people were buying these watches and thinking that this was true. The FDA have said this: we're warning patients and caregivers and health providers that smart watches and smart rings that try to claim blood glucose levels without piercing the skin, it's not true. You can obviously display a glucose measurement on a watch, but it'll probably be linked to something. When I say something, it would be displaying the data that was coming off a device more like this. Let me just grab this one. This is again the Abbott product. This works, and yeah, it'll give you blood glucose, and you can show that on a watch or you can show that on a smartphone. But this has a filament on it. I might just change the screen a little bit. Whoops, a daisy, wrong screen. This has a little filament that actually goes through the skin. It's piercing the skin. This microneedle, in fact, there's these little microneedles on here. This pierces the skin. The FDA says if it doesn't pierce the skin, you can't be measuring things like glucose. I know there was, I saw them myself on Amazon, that they were claiming, we can measure these analytes. But see, I can understand ECG, I can understand PPG. ECG is an electronic signal. PPG is a unique and SpO2 are unique because actually hemoglobin has a very intense color. It's unique. Glucose has nothing special about it that makes it easy to spot through the skin. So, and I mean, I'm in accordance with the FDA. Unless it's broken the skin, it's not measuring the glucose. So questions number one, an explanation of cyclic voltammetry. I got a suspicion with your cyclic voltammetry, you're basically measuring oxygen as the source of that signal. I got a suspicion that the aromatic compounds are sticking to your electron and blocking it, and the hexane is actually washing away your polymer and exposing it, so you can increase the oxygen reduction. Drop casting onto SPEs, screen printed carbon electrodes, or SPCEs I should say. It's quite straightforward now with that circular electrode. If you want two working electrodes, we can make it for you, but we would do it as a micro project. Luminol on bare electrodes. Yes, you have put a polymer on those electrodes. You can see it going from the graphite to the graphene, and thank you for finally somebody helping to demonstrate that graphene is not the magic material when it comes to biosensors. But then you have put that polyluminol down, I can see that, but it's not then able to exchange electrons with the ferrocyanide, and that's why you have a big charge transfer resistance, and then you lose all your activity in the cyclic voltammetry. If you want to do a wearable glucose sensor, I've shown you the electronics, I've shown you the sensor, and I've shown you the calibration solution. And question number 6 shows you it all works together. And they're obviously several months ahead, let's say. Question number 7, you can do glucose and lactate and hydrogen peroxide, no sweat with that. We've got the sensors. We're not going to offer the cortisol, but you can see that we've got the electronics and the sensors. Question number 8, if you're super interested in dehydration, then you have to do some literature review and just look up whether you believe in potassium or sodium for dehydration. I would honestly just start by looking at question number 6 and actually going after glucose to start with, just to get familiar with this kind of technology, because people can be full of ideas and what they want to do, but just get your feet wet like question number 6 has, and then you can move on then to the the next phases. So if you have any questions of ZP, you can see we put quite a lot of work. I'm just trying to see how long we've been going for. Not entirely certain, but we do put a lot of work into 38 minutes. There we go into this. So if you've got any questions, don't hesitate to reach out to us. Okay, thanks very much.